cannot do does not exist. What our God cannot do does not exist. My name is Collins and this is Josephine, my spouse, and we are giving this testimony from the UK. We have come to testify about what God has done in our lives. God did a great thing for us on the 5th of May this month. After I came back from work from my night duty, I was lying down on the bed. My wife had gone to work, and then at about 3:30 she came back. She was looking frustrated, she was angry, and she was just like, I'm going to resign from my job next month. After that, she went to the kitchen, she made food. We both ate the food. She had a bath, and then we both sat on the bed and we were watching the TV. I think she was actually pressing her phone. Just around that time, she jacked up from the bed and she was like, babe, I can't breathe. And so I was trying to give her a cuddle. I was rubbing her back and I was like, what do you mean you can't breathe? Before I could say jack, she shouted that I should call the ambulance. And what I observed was that her pupil, the black of her eye, had disappeared. It was just as clear, the white of her eye that I was seeing. She was already cold. She had collapsed. She was already cold, floppy, and at the same time looked like there was no sign of life. So immediately I shouted for help. So I had to put my wife down on the floor. I ran out of the room. I banged on the guy's door to come out to help me call the ambulance. And so eventually he came out, he called the ambulance, and when I rushed back into the room, my wife was lying down lifeless, secretions coming out from her mouth, her teeth was clenched. I am a medical person myself, so I tried to see if there was any sign of life. I checked her pulse, her carotid pulse, I checked her brachial pulse, I checked all the pulse. There was no sign, there was no pulse, there was no sign of life. She was not breathing, there was no chest rising or falling, nothing. She was cold, she was stiff, she was rigid. At this point in time, I already started crying. I was like, wow, is this how my wife is just going to go? I was like, oh, wait, you will not swallow my wife. You will not swallow, I will not bury her. My wife was dead. I started speaking with the ambulance team after my neighbor had helped us to put a call through. So I started doing CPR. They asked me to start doing CPR. I was doing CPR. I was just doing CPR. The more I was doing CPR, the more the secretions were coming out, like, you know, a typical dead person. After 5 minutes, the first set of paramedics came. They rushed into the room. They asked me what has happened. And I was like, I don't know. She just jacked up from the bed and suddenly she collapsed and, you know, she became lifeless. I can't feel any pulse, no heart rate. And they hurriedly fixed like a patient monitor on her to see if there was anything. They checked her pulse, they checked all areas on her body. There was no pulse. The monitor didn't, you know, read any pulse rate. There was no heart rate, there was nothing. They quickly tried to see if they could insert a cannula. They couldn't get a vein. All the veins collapsed. And so they got confused at some point and they had to call for a backup. At that point in time, they attached a defibrillator on her. They tried to deliver a shock, and the defibrillator said there is no shockable rhythm, so he couldn't deliver a shock. So they had to, you know, opt for intraosseous, where they fix a cannula into the bone because they couldn't get any of her blood vessel. While all of this was going on, she was stiff, she was gone. I can tell you, my wife was dead. And then while that was going on, 10 minutes has passed. She was still lifeless. After 15 minutes, Pastor Jerry, after 15 minutes, at this point, they have called for a third paramedic team to come around. This time it was the paramedic doctors who came, 2 of them. They came. After 15 minutes, there was a sign of pulse. The pulse was about 28, a very low pulse from the monitor. And it was like, okay, there is a sign of life now, sign of pulse. And then eventually she started breathing. We saw an heart rate on the monitor and it was just a very low one. And that was how they rushed her. Before they rushed her, asking me questions, they started asking me if I'd given her any medication, any drug and all of that. And I was like, no, I didn't give her. that I'm even a medical person and I work in the same hospital where you people are coming from. I didn't give her any medication. Before they put her into the ambulance, she had vomited twice. They rushed her. We got to the accident and emergency. While we were there, as soon as they brought her out from the ambulance, she started verbalizing pain. She started saying, my chest is paining me. With, unconsciously, with her eyes closed, she would say, my chest is paining me. I'm having lower abdominal pain in my chest. They rushed her in. She was admitted in the emergency unit. They had to fix all kinds of lines. They had to look for a scanning machine to get her blood vessels, so they would scan her hands, her legs to see, get in. They finally were able to get a vein through with a scan, and then they gave her IV fluids. About 4 IV fluids were running and all of that. As that was going, suddenly she started stooling. My wife was on the average every 15 seconds. She stood past stool over 30 times. She was stooling every 15 seconds. At some point, even when I give her the bedpan, just when I'm about to take off the bedpan, she will tell me again that she wants to poo. I'll have to give her the bedpan again. That went on and on and on and on. And then for me, I was like, God, thank you for, even restoring her back to life. But for me, from the medical perspective, I felt like even though I have to deal with a vegetable for the rest of my life, because you can't have a downtime of 15 minutes and come back normal. In fact, it will be better that the person dies than to come back alive, because the brain will be completely gone and everything, So that was just my contemplation. That was my thinking. But I kept thanking God. I kept believing God. I kept saying those words: the earth will not swallow my wife. He will not swallow. I will not bury her. I will not bury her, and all of that. I kept making those declarations. And then at some point, I noticed she also now started opening her mouth to pray. Sometimes she would shout, Eroi, Eroi, and then she would close her eyes, and then later she started praying and praying and praying. The OH prayer. At some point, one of the senior nurses was like, I can see your wife is very religious. And I said, yes, my wife is very, very religious. And so that went on and on. When I thought I had seen it all, while she had all the IV fluid, the arterial line all, running, she just jacked up again from the bed and she started vomiting blood, loads of clotted blood. I shouted, I said, doctor. And so one of the senior nurses rushed in, and then when he saw the blood, he was like, whoa, I need to get the doctor now. We need to get the emergency doctors now. So he went to call the doctor, and then my wife had vomited. The whole floor, the bed sheet was with clotted blood. So they rushed her to the X-ray. She was praying all along, even in that level of unconsciousness. I will not be buried, I will not be buried, the body of my loved ones, no one will be buried. She was just praying, she was shouting. Occasionally she would shout, Eroi, Eroi, and then they rushed her into the X-ray. They did a CT scan of the chest and the abdomen, and they brought her back to the emergency. They had to keep her in the emergency unit because it felt like there was no need to step her up, because it felt like she's not, even though she had survived the first 15 minutes, she's been able to open her eyes after the 15 minutes of downtime she had in the house. But with this one, it felt like this is going to be like a 50-50 thing. So they kept her in the emergency unit for long. We got to the emergency unit at about 7:35 thereabout. And then it was in the dead of the night that they had to transfer her to the intensive care unit when they saw, she was still alive. So they felt they could salvage things now. So she was stepped up to the intensive care unit. When we go to the intensive care unit, surprisingly, they will ask her questions, even in that level of unconsciousness. Her GCS was 13. They will ask her, what's your name? She will say, my name is Josephine. She will say her name correctly. She started seeing the nurses, seeing the doctors. She will ask them, do you know Eroi? Do you know Eroi, the God that sees me? I saw a Roy. I saw a Roy. It was glorious. There is nothing you can use to describe what I saw. So at this point, this testimony is a very long one. It's going to take a lot of patience to complete it, but we're just trying to summarize things.
I just want to say thank you once again, Pastor Jerry. We thank you for inviting the word of God in our lives and teaching us how to pray. So while all this was going on over here, they were all struggling to revive me. I had an encounter. I was cruising with a Roy. So I just noticed I started walking with a man, and every time I call him, so if I want to converse with him, I will shout Eroi. So while I was shouting Eroi over there, I was mentioning the Eroi here. He asked that question 3 times. Do you want to go back or you want to fellowship with me? And I said, when he asked the 3rd time, I just got married 2 weeks back. Before this whole incident happened, I was like, what would happen to this man? What would they say happened that the doctor that they gave to him? What happened? Nothing happened to her when she was not married. Is it now that she's now married that you now say something happened to the woman that we gave to you? And I remembered this, and I remembered my mom. I just disappeared and I came back to life.
They did a toxicology test to see if giving her anything, if she had taken any medication. They did a CT scan of the chest and the abdomen. They did all the blood screening. They did for infection, virus, bacteria. They did a blood gas. They did troponin test. They said the troponin test was high, but it was because of the CPR I was doing. They did all kinds of tests that you can think of. They got to a point, one of the senior cardiologists was like, Josephine, your case has defied medical practice. We have never seen anything like this before. This happened in the city of Bristol because we live in Bristol and is in Bristol Hospital, the Bristol Trust. So she was like, your case has defied medical practice. CT scan came back normal, MRI came back normal. They insisted that they are going to do an angiogram where they insert like a tube that has got a camera on it, and they will take it from your hand up to your heart to check the heart if there is any issue, and they couldn't find anything. They became more confused. They called the occupational therapist to come and test if she's got mental breakdown, dementia, whatsoever, because at some point they thought she was confused
when she was
calling asking them, because she asked all
everybody
of the doctors
and all the nurses,
do you know Eroi? Do you believe in God? Do you know Eroi? I saw Eroi, And then the occupational therapist came in. They tested everything. They asked her to read math to solve. She solved everything. She read everything correctly. The physio team came, tested. They were all wowed. They were like, this is strange. That was the best word they could use. This is strange. We've never seen anything like this. And then they went further to do an EEG. They referred that to a neurologist. The neurologist did the EEG, came back normal. That it got to the point the neurologist had to private call me. A senior neurologist had to call me privately to ask me and say, oh, Collins, sorry to bore you with these stories, but I know you have narrated these things several times. Can you tell us again what happened? Long story short, all investigations done. They repeated the blood over and over again. Everything came back normal. This is our evidence. We carried the evidence. This is the discharge letter. Even at the point of discharge, we still took our blood. And they were like, they were going to check. They can't understand it. We have never seen anything like this before. These are all the tests that they do. You can see. This is our evidence. We just want to use this opportunity. This testimony, if we were to see it the way it is, it will take us over an hour, but we're just trying to break it down, trying to summarize it. We just want to thank you, Pastor Jerry, for what you are doing, for teaching us how to pray, for teaching us how to believe in God, that even at the point of death, one thing I heard was like, even though God takes this woman from me, it will not stop me from loving God. It will not stop me from loving God. And this is a pointer to the fact that God is real. Hell is real.
Heaven is real. Heaven is real.
And so we want to also use this opportunity to encourage all NSPPGians
That
to
God
hold
sees
on
you.
to God. God sees you, your prayers. I mean, for God to reveal my silent prayer to my wife. My wife told me my own silent prayer, the prayer, my personal prayer that I'll be praying to God that she doesn't even know about, the CPRO thing, everything. And God gave her a word for my relatives. Some members of you mentioned names, and these things were true. We can't say it all as a go. We just want to say thank you, Pastor Jerry, for and all the crew members, everyone saying amen to our prayers. And we said we have to come and testify of the goodness of God in our lives. For indeed, what God cannot do does not exist.
In the show. Thank you.